So to discuss the distribution of the sympathetic nervous system, we're going to start by drawing the brainstem and spinal cord in here. And I want to remind you that the sympathetic nervous system is distributed from T1 to roughly L2 regions, and it's located in the medial cell column of the spinal cord. And it goes to the sympathetic chain ganglia, also known as the paravertebral ganglia, which stretch all the way from the base of the neck down to the base of the sacrum and the coccyx. So from here, as we talked about in the previous little animation, each one of these levels from T1 to L2 is going to give off a branch of presynaptic sympathetic neuron that goes through the spinal nerve into this anterior ramus, then jumps onto the white rami communicans to get to the sympathetic chain and paravertebral ganglia. So we'll draw in those connections right here. So from here, these can synapse and head back out of gray ramus and get to the body, or they can ascend and descend, synapse and head out to the body, or they can pass through here without synapsing and go to the abdomen and pelvis. Now the first thing we'll talk about is if they're going to the heart and lungs, which we'll draw in right here. They will synapse in the T1, T2, 3, 4, and 5 ganglia, and then these will head out as thoracic splanchnic nerves and join the cardiopulmonary plexus to reach the lungs, the bronchi, and the heart itself. So here, T1 to T5, if they're going to thoracic viscera, will synapse in the paravertebral ganglia and then head out as thoracic splanchnics. Now that's important to note because it's the exception to the rule. Most of the time, these are going to enter, if they're going to visceral targets, enter the paravertebral ganglia and pass through without synapsing. So they will be presynaptic splanchnic nerves. And right now, the ones that we care the most about in the thorax are the thoracic splanchnics, which are the greater, coming from T5 to T9, the lesser coming from T10, T11, and the least splanchnic coming from T12. Now, in point of fact, there's quite a bit of variability about which vertebral levels and which areas of the paravertebral ganglia contribute to the greater, lesser, and least splanchnic nerves. So maintain a little mental flexibility in this area, but for the purposes of this course, we'll be treating them as though they come from T5 and T9 always for the greater, T10 and T11 always for the lesser, and T12 always for the least splanchnic, which I should spell correctly right here. Now what's important about these ganglia and the presynaptic sympathetics coming to them is that they project to abdominal and pelvic organs. And the way we want to remember those is that they have to synapse somewhere, and that somewhere is in a prevertebral ganglia. And these are associated with the vessels of the abdomen and pelvis. So we'll draw in the abdomen, or the abdominal aorta here, and the vessels. So here we have the celiac trunk giving off the left gastric, splenic, and common hepatic arteries, the superior mesenteric artery, and just below that we'll draw in the renal arteries. Heading down the aorta, we'll draw some small gonadal vessels coming off the side. Ovarian or testicular artery. Then the last unpaired artery is going to be the inferior mesenteric, jumping off right there, before the aorta splits, bifurcates into the right and left common iliac arteries. So each of these large vessels tends to have a ganglion associated with it. And these ganglion are where the postsynaptic sympathetic cell bodies are hanging out. So right here we've got the celiac ganglion. Right here we have the superior mesenteric ganglion. The ones associated with each renal artery are called the aorticorenal ganglia. And here we have the inferior mesenteric ganglion sitting at the base of the inferior mesenteric artery. And in between these we have some scattered axons and scattered cell bodies that are referred to as the intermesenteric plexus. We'll discuss that one a little bit more in conjunction with two other plexi that are a little bit different. We have scattered cell bodies at the bifurcation of the aorta called the superior hypogastric plexus, and then just inferior to that we have a collection of cell bodies, once again, on either side called the inferior hypogastric plexus. These are all connected through axons that project to and from each, and we'll discuss those a little bit more in conjunction with the pelvis. For the moment, what we're going to talk about is the greater splanchnic, T5 and T9, preganglionic or presynaptic sympathetics, passing down through the diaphragm and jumping onto the aorta and synapsing in the